Welcome to the 2019 open enrollment period for health insurance, flexible spending accounts for medical expenses and childcare, and the Courtesy Corporation's 401k plan. Health insurance helps keep you and your family healthy by providing preventative care and helps protect you from large medical bills in case of an emergency in the future. There are several ways to obtain health coverage. You may be eligible for Medicaid or CHIP based on family income. Go to cms.hhs.gov for more information. Typically, individuals become eligible for Medicare at age 65. Learn more at medicare.gov. If under 26, the law allows you to get coverage through your parents' medical plan. If you have a working spouse, you may be able to get coverage through his or her employer. It's worth checking the coverage and costs and choose the option that makes sense for you and your spouse. Check out healthcare.gov for the marketplace information in your state. Open enrollment for marketplace coverage is November 1st through December 15, 2018. Other options, including your employer coverage, are also available. Insurance benefits are available to eligible employees who consistently work 30 or more hours per week. Hours for crew members are tracked over a 12-month measurement period. Crew must average 30 hours or more of service per week during the 12-month measurement period. Employees who do not average at least 30 hours of service per week are not eligible for health benefits unless they have a change in employment status that makes them eligible for benefits. All levels of managers, supervisors, office staff, third shift janitors, preventative maintenance, and traveling maintenance who consistently work 30 hours or more per week are immediately eligible following a 30-day waiting period. Therefore, promotion from a part-time crew member to one of the eligible positions listed would make you newly eligible for insurance. However, a promotion from a swing manager to a first assistant or a promotion from a third shift janitor to a preventative maintenance employee will not change your eligibility status. Each year, open enrollment packets are mailed to the home addresses of all eligible employees. If you elect health insurance through Courtesy Corporation, you may have several questions. Compass Health Pros can help you understand insurance benefits and plan options, find doctors, save money on health care, pay less for prescriptions, resolve billing issues, schedule appointments. You can use Compass free of charge. Call 1-800-941-9260 or email McDonald's licensees at compassphs.com to get started. Or text COMPASS to 214-220-4608 to get the app today. Courtesy Corporation offers benefits through McDonald's licensees Health and Welfare Plan. The following coverage is available: major medical, dental and vision, life insurance, including basic life and supplemental life, long-term and short-term disability. Each coverage can be elected independent of another. Employees don't need to take medical coverage in order to elect any of the other coverages available. You may pick and choose whatever benefit options you wish. For example, you may wish to enroll in dental coverage. The only exception is that you must have basic term life if you wish to add any additional supplemental term life. All employees should actively sign up during annual enrollment to make sure they have the medical benefits they want for 2019. Employee annual enrollment ends on December 19th. For those currently with benefits, now is the time to evaluate your 2018 benefit elections to see if they will continue to meet your needs in 2019. If you currently have any combination of benefits through McDonald's licensees, you may choose to change, drop or add coverage, or increase or decrease your medical deductible at this time. Please review the information carefully and follow the online enrollment instructions to make any changes to your coverage for 2019. If you currently don't have any benefits through Courtesy Corporation, now is your opportunity to enroll during the open enrollment period. Any changes or new coverage will all be effective January 1st, 2019. If you don't wish to enroll in any benefits, please go online to decline coverage or return the health insurance acknowledgement form that was mailed to your home to Sean Sen at the Onalaska office. The online enrollment is easy. Get started at mymcdbenefits.com. To log in, you must enter your username and password. Your username is your first two letters of your first name, both capitalized, the last four digits of your Social Security, and your 6-digit date of birth. Your PIN is your 4-digit birth year. After logging in, you will have the opportunity to review your benefit information for 2019. After you review your plan options and costs, the costs have been included in your open enrollment packet that was mailed to your home. The website will guide you through several screens where you can elect or decline benefits for 2019. Your elections will not be recorded or saved until you confirm. Write down your confirmation number and keep it for your records. You will need your confirmation number if you call the support line or if you return to make changes. You can return and make any changes to your elections at any time before December 19th. If you have issues with the online enrollment, you can contact the support line at 1-866-962-2303. For those currently enrolled in medical coverage, it's important to note that the medical plan options offered this year are all new. The chart shows how your 2019 plan will align with your previous year's elections. So if you had bronze coverage in 2018, that will now be Health Plan 1 for 2019. Silver will be Health Plan 2, Gold is Health Plan 3, and Gold Plus is Health Plan 4. If you do not go online to make any changes, remember your 2018 plan will automatically convert to the new 2019 plan. Even though the medical plan options are new, they still provide access to the same great Blue Cross Blue Shield of Illinois network of doctors and providers. It still provides 100% coverage for in-network preventative care and coverage for prescription drugs. And remember, each plan covers the same benefits and care. The difference is mainly in whether you pay less each month in premiums or less when you need care. In general, Health Plan 1 employees will pay less from their paycheck each month, but more when they need care. In Health Plan 4, employees pay less when they need medical care, but more out of their paycheck each month. As an employee, you are eligible to enroll in medical insurance through Blue Cross Blue Shield of Illinois. Employees are offered a comprehensive medical plan that also includes prescription drugs. The medical plans offered provide a foundation of protection for you and your family. Medical coverage is provided by a preferred provider organization. A PPO is a network of doctors and hospitals that offer quality services to you at a negotiated rate. You can see doctors out of network, although at a higher cost to you. It's important to always check to see if your doctor is in network. To do so, you can call Blue Cross Blue Shield at 1-800-730-8445 or visit the website at www.bcbsil.com/licensees. All participants, including those currently enrolled in medical coverage, will be mailed new ID cards this year. If you enroll in the plan, you can also enroll your eligible dependents. You can enroll your spouse or domestic partner, as well as your children or your full family. Your spouse, your children, or your domestic partner's children, stepchildren, and legally adopted children are all eligible dependents. You can cover adult children up to the age of 26, even if they're not your dependent for income tax purposes, even if they're not in school, if they are working and have coverage available through their employer, and/or are married. Here's a closer look at the 4 plan options. Each year after you meet your deductible amount, the plan pays a percentage of your eligible medical expenses until the annual out-of-pocket maximum is met. For example, Health Plans 2, 3, and 4, the coinsurance is often 70%. The coinsurance is 60% in Health Plan 1. After that, the plan pays 100% of your eligible expenses for the remainder of the year. The plan will pay 100% of the cost for certain services, including wellness benefits, before you meet the annual deductible. If an employee covers 2 or more dependents, the deductible is met when the aggregate of individual deductible amounts meets the family amount. Including your deductible, the most you'll pay out of pocket for in-network coverage in the calendar year in all 4 medical plans is $6,500 for employee only, or single coverage, or $13,000 for all other coverage levels, including family. Health Plan 1 is a high deductible health plan that is compatible with a health savings account, or HSA. The summary on the screen is also included in your enrollment packet. Doctor on Demand offers live video doctor visits with a low copay for medical plan participants. Online or via a mobile phone, you can easily access a physician who can provide an assessment, diagnosis, or even write a prescription. Health Plans 2, 3, and 4 cover these visits at just $10, while Health Plan 1 costs $49 per visit. You'll save money and time and get great care from a board-certified physician through Doctor on Demand. To download the app, text the word REGISTER to 68398. When you enroll in any of the plan's medical options, you are automatically enrolled into the prescription drug card program provided through Express Scripts. The plan offers 2 ways for you to save on your prescription drug needs. Walk into any retail pharmacy and have up to a 30-day supply of your prescription filled at a discount. When you need a prescription filled for long-term maintenance medications such as oral contraceptives or diabetes and blood pressure drugs, you can get up to a 90-day supply through the convenience of home delivery. As you can see from the table, you will pay less for generic drugs and by using the mail order service. You pay $10 for a 30-day supply filled from a retail pharmacy. You pay only $25 for a 90-day supply from the mail order service. If you choose, you can have your prescription refilled with a brand name drug when a generic is available. However, you will be responsible for paying the brand name coinsurance plus the cost difference between the generic and the brand name drug. Please note that some drugs may require the mail order pharmacy service. Important note, for prescription drug coverage in Health Plan 1, any prescription drug costs apply to the medical plan's deductible, coinsurance, and out-of-pocket maximum. This means you pay 100% of the cost of any prescription drugs until you meet the medical plan's annual deductible. When you enroll in the health plan, you automatically receive mental health and chemical dependency benefits, and you are automatically enrolled in Life Compass, a confidential service meant to help you balance your work and your life. It offers counseling and referrals in a variety of areas. The Employee Assistance Program is meant to help you balance your work and life. Through the EAP, you can get 3 free sessions of counseling and a variety of other services. Please review the slide for the summary of mental health coverage available to those enrolled in Health Plans 2, 3, or 4. For those enrolled in Health Plan 1, mental health and substance use disorder benefits are provided at the same coinsurance percentage as any other office visit or inpatient admission. Dental insurance is a great way to get free preventative care along with other restorative care benefits for you and your eligible dependents, and includes orthodontia for dependent children up to the age of 26. The dental plan offered through Delta Dental also provides benefits for oral surgery and other dental cutting procedures. Nearly 75% of dental providers are in the Delta Dental PPO or Delta Dental Premier networks. Participants can go to any licensed dentist, and benefits are the same whether or not you use a network or non-network provider. Delta Dental has negotiated lower fees with dentists in network. With those lower fees, your out-of-pocket costs should be less. Benefits for the Vision Care Plan are provided through iMed. iMed's network includes private doctors as well as major chains like LensCrafters, Pearl, Vision, or Target. Please see the slide for a summary of your vision benefits. When you enroll in medical, you are automatically enrolled in the basic term life insurance and accidental death and dismemberment coverage valued at $15,000. If you choose not to enroll in the medical plan, you can still elect to enroll in basic life and AD&D benefits. Basic life insurance pays benefits to a beneficiary in the unfortunate event of your death. AD&D insurance pays an additional benefit to your beneficiary if you die in an accident or suffer a severe injury such as a loss of a limb or eye. If you participate in basic term life, you can choose to increase your coverage by purchasing supplemental term life. You may elect up to 10 times your annual salary. Election of 1 times your annual salary is guaranteed without evidence of insurability during this annual enrollment period. Those new to the plan can elect up to $500,000 in coverage without providing evidence of insurability. Again, you must be enrolled in Basic Life to elect Supplemental Life. Supplemental Life is also available for your eligible dependents. Short-term disability coverage is available to help protect you against loss of income in the event of an extended illness or injury. There are 2 short-term disability options. Short-term disability 500 pays 50% of your earnings up to $500 per week, and short-term disability 1000 pays 66 2/3 of your earnings up to $1,000 per week. Short-term disability begins paying benefits on the 15th day of sickness or injury. Benefits are payable for 26 weeks or until your disability ends, whichever comes first. Long-term disability coverage pays benefits after 180 days of consecutive disability. The monthly benefit is 60% of your monthly income up to a maximum monthly benefit of $5,000. Benefits generally continue until your normal retirement age. Again, you can elect disability without providing evidence of insurability during this annual enrollment. New participants will be subject to pre-existing condition limitations. Courtesy Corporation offers eligible employees the opportunity to purchase qualifying health insurance that is intended to be affordable. Please see the rate sheet that was included in your enrollment packet for more specific information about your costs. All rates listed on the rate sheet are monthly costs. For operations managers, area supervisors, general managers, first assistants, and salaried office staff, Courtesy Corporation pays 50% of the monthly premiums for any medical, dental, and vision. Courtesy Corporation also pays 50% of the monthly premiums for basic term life and disability. Employees are responsible for 100% of the cost of supplemental term life. Rates for the health plan are based on the enrolled employee's age, and payments are deducted from the employee's biweekly payroll. For example, if your monthly cost is $400, we multiply the cost by 12 months, which gives us $4,800. We divide that by the 26 pay periods per year, and then divide it by 2 since Courtesy Corporation pays for half the cost. For all second assistant managers, hourly office staff, third shift janitorial, preventative maintenance, and traveling maintenance, Courtesy Corporation also pays 50% of the monthly premiums for all medical, dental, vision, life, and disability coverage. Employees are responsible for 100% of the cost for supplemental term life. The only exception is that Courtesy Corporation will use the rate of pay approach to determine the monthly cost of single coverage in Health Plan 1 only. The example is the same for how we determine the cost for crew members, associate, and swing managers. For crew members, associate, and swing managers, Courtesy Corporation will use the rate of pay approach to determine affordability. Again, affordability is based on single coverage through Health Plan 1 only. An example of the rate of pay calculation for an employee earning $11 per hour is listed on the slide. The monthly cost for single coverage in Health Plan 1 would be $141 per month. Don't forget, you are paid biweekly, so the biweekly calculation would be $65.08 per pay period. Crew members, associate, and swing managers can elect coverage for children, spouse, and/or family in any of the other coverage options. However, you will be responsible for 100% of the cost. Employees also have the option to elect individual coverage through Health Plans 2, 3, or 4. Courtesy Corporation will contribute 20% towards the cost of these benefits. Employees are responsible for 100% of the cost for dental, vision, basic life, supplemental term life, and disability coverage. Some common questions. If I currently participate in the plan and do not wish to make any changes to my current benefit offerings, do I need to do anything? No, you do not wish to do anything. Your current benefit elections will automatically continue for 2019. If you do not wish to participate in any benefits, we do ask that you follow the online enrollment steps to decline coverage or return the health insurance acknowledgement form that was included in your packet to Sean Sen at the Onalaska office. If you currently participate and have changes, now is definitely the time for you to look at your 28 benefit elections to see if they're going to continue to meet your needs in 2019. You may choose to change, drop, or add coverage, increase or decrease your medical deductible at this time. If you ever lose coverage in the future, you will have 30 days to enroll in Courtesy Corporation's health plan. An example of a loss would be turning 27 years old and no longer being eligible under your parent's plan. You would need to log onto the website to elect coverage within 30 days of the loss. If you have a baby or get married in the future, you will also be able to add benefits as long as you do so within 30 days. For both questions 4 and 5, proof of loss, proof of birth, or marriage will be required. Courtesy Corporation will continue to offer flexible spending options for medical expenses and dependent care or daycare expenses for 2019. This means that you can set aside tax-free dollars to pay for medical, dental, and vision expenses up to $2,650 for 2019 that are not covered by insurance. In addition, daycare paid while you're working can also be paid up to $5,000 for 2019 with tax-free dollars. The Use It or Lose It policy will allow employees who have not used $500 or less of their current medical FSA benefit to carry over to the next plan year. You are not required to be currently enrolled in medical to participate in the flexible spending plans. Important, even if you participated in 2018, you must complete a new FSA enrollment for 2019. Your enrollment packet included a paper enrollment form for flexible spending accounts. You may complete the paper enrollment form and return it to Sean Sen at the Onalaska office by December 19th, or go to 3pa.com to enroll online. The online enrollment instructions are on the screen as well as in your packet. Again, even if you're enrolled in the FSA benefit for 2018, you must re-enroll for 2019. Now is the open enrollment time for our 401k plan as well. Important, you must be eligible before you enroll in the plan. Who can join? Employees who have completed 1 year of service, a minimum of 1,000 hours, and attained age 21. If you're interested in enrolling, contact Sean Sen for a 401k packet. We can mail that to your home. Don't forget, open enrollment ends December 19th. If you have any questions about any of the benefits, feel free to contact Sean Sen at 608-781-8080.